CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.
Helping you lead a healthier life. This is CURES.
Hi, everyone. Welcome to the CURES show, where we explore cutting-edge wellness from credible sources. I'm Kara Sundlin. I'm really excited for today's show, as we're going to talk about mastering menopause, and that includes perimenopause. We're going to take a deep dive into all the questions and all the answers. And I first, before I bring on our guests, want to let you know we're hosting a great event locally in the Hartford area at the Mandel JCC on Thursday this week, which as of this taping will be 16th, right? October 16th. It's Thursday, the 16th or 17th. I don't have a calendar in front of me at 5:30 p.m. So before we take a deep dive, I want everyone to know that's free and come join us. I want to bring in Tanya Smith. She's a certified nurse midwife, and nowadays she is spending most of her time helping women through this transformative time. Tanya, thanks so much for being with us.
Thank you very much for having me.
You know, I was telling you before the show that the feedback I'm getting is so many folks just saying, I'm so glad you're talking about it. No one used to talk about this. And women, even in their 30s, noticing changes, but not even realizing it could be related to perimenopause.
Absolutely. We've really just stopped educating women on what's happening with their bodies through this transition. And so a lot of women don't even realize the symptoms they're having are attributed to perimenopause and the changes in their hormones.
Yeah, I in my 40s, the pandemic happened, and I think I really noticed some tough nights sleeping and more moodiness and a little bit of brain fog, but I really attributed it to the pandemic. But looking back, I think it was not that the pandemic wasn't stressful, but it was probably also a lot of shifting hormones. Okay, and that's, I mean, women right now, we have a lot on our plates, but the changes in the hormones could be adding to that insomnia or those 3 o'clock wake times or any sleep changes. Also, people starting to gain weight in the middle and not knowing why the things they used to do didn't work. These can all be related to perimenopause and menopause?
Absolutely. It all kind of works together. So if you're not getting good, restful, restorative sleep, your hormones aren't resetting as far as your appetite control. The lack of estrogen is creating inflammation throughout your whole body, which is going to result in like a whole flurry of symptoms that are going to affect every part of your body, from hot flashes, weight gain, joint pain, just a number of things.
Okay. And how early might this start for women?
So it's typical for women to go through menopause between the ages of 45 to 55, and that's considered 1 full year without your period. But it's normal to start noticing the symptoms of perimenopause up to 7 to 10 years before that time. Mm-hmm. So it's not impossible to start noticing symptoms in your 30s.
Yeah, or even 10 years before 45, that's 35. You're still having babies sometimes.
Absolutely.
Okay.
And you still could be getting regular periods and still noticing these symptoms as well.
Okay, so that's one myth, that if you're getting regular periods that you're not being affected by menopause.
That's definitely a myth. You are going to notice some of these symptoms a lot of time before any of your periods start to change.
So let's talk about some of the symptoms, because I think some of them women don't even realize.
Yeah. I think most women assume that if they're not having hot flashes, that menopause isn't really affecting them. And that's totally not the case. Regardless of whether or not you're having symptoms, the lack of hormones are having an impact on your body that you have to be aware of. But also women will notice like joint pain is a really common one that women don't attribute to it. Frozen shoulders, hip pain, things like that tend to get progressively worse. Itchy, dry skin, weird tingling feelings, palpitations, increased anxiety, lots of variety of different things you can notice.
Okay. So what do you think women need to know as we are now starting to talk about it? And I again said we're going to have a great event. You're one of the speakers. But so many people are going, okay, great. No one ever told me about this. Now I'm going to learn about it. And what can I do about it?
Exactly. So we're definitely hoping to spread awareness so that women are able to figure out what's causing their symptoms and see the treatment options available. But I also want women to really have an understanding of what's happening with their bodies through this transition and the impacts these hormones are having. So even if you're not having a lot of symptoms, you still want to know what's going on so you can make good choices on how to, protect your health moving forward. So we're going to be having a conversation about, hormone replacement, lifestyle factors, and alternative medications that can help with symptoms as well.
Yeah, I mean, which is really interesting because you're bridging the gap, I think, in what you do with some of the more holistic medicine and some of the traditional, whatever we would have gotten from our traditional docs. I think it's not, no criticism to the medical profession because we have some great doctors out there, but would you say that menopause and perimenopause and all the symptoms that it comes with have just not really been talked about in the doctor's offices that much?
Absolutely. It's honestly not your doctor's fault. There really has been a lack of education in medical school, residency programs. Even with my own midwifery training, we didn't really spend a lot of time talking about menopause. There's been a lot of fear circulating hormone therapy, but the data that we have now is showing that hormones are safe for most people. And so women should have a conversation about their unique risk factors and see what's right for them.
Yeah, and that's one of the things we're going to see at the event. And if you can't come to the event, I encourage you to watch the movie The M Factor, which does a nice job of just exploring so many people's stories and all the different things that are out there. And some of the strange symptoms, like who knew that menopause could affect your teeth even?
Yeah, it's actually really common for women to lose a tooth in the first couple of years after menopause because of their changes to their gum health and their oral microbiome, all of those things that happen through menopause.
I had no idea. Like when I saw that in the movie, I was like, what? And I don't think a dentist has ever mentioned it. I mean, maybe they would if you had a tooth loss. I didn't experience any of that, but I don't think I've ever heard that until we started talking about this and saw the M Factor movie.
Yeah. Estrogen really has an impact on almost every cell in your body. So it's going to have different manifestations all over your body when the deficiencies start kicking in.
So now you're a menopause specialist. What kind of extra training? How do you now know all this, and why, like, compared to maybe some doctors who maybe got an hour or two of instruction when they were in med school?
Right. So I actually had to go on my own to find the education. So I started with the Menopause Society, became certified with them, and then went on to find advanced training for prescribing hormone therapies and really getting well versed in, the new recommendations, reviewing the data, and, updating some of the guidelines and thoughts that we had in the past.
Okay. And so currently, let's say, what's step one? Would you just base things on symptoms? Would you get a test to find out where your hormones are at?
It really depends where you are in the process, but if you're in that perimenopausal phase, labs really aren't accurate. Your hormones are constantly changing, and it's really difficult to make treatment recommendations based on that. So it's not typically the first thing I recommend. I'm usually treating mostly off of symptoms, unless there's another concern. You want to make sure your thyroid's functioning normally and you're not having vitamin deficiencies or something else going on that could be causing those symptoms.
Yeah. And in fact, that's one of the things, I know if you're going to your regular physical, they're going to screen for your thyroid. Anything else that women in this midlife should be asking for to get a baseline on what we need to know for our tests?
Really think that women should be seeking out, somebody knowledgeable in menopause and having a real risk assessment with them. And ideally doing this before a lot of symptoms kick in. Menopause is not optional. Every single woman who has ovaries is going to go through menopause. And so having a plan for how you're going to manage that, I think, would be the ideal for most women.
Yeah. So let's talk about hormone replacement therapy. Certainly something that a lot of people are talking about, even the idea of doing it before you hit menopause. What exactly is it? How do you take it? And who should?
So hormones, basically, once you go through menopause, your body stops producing most of your estrogen and progesterone, and also your testosterone starts to decline as well. So in perimenopause, we can kind of replace some of those hormones to help with some of the dips in the lability of it to kind of control symptoms. And then after menopause, it's basically replacing that estrogen to help, keep your bones healthy, cardiovascularly, brain health, things like that. Typically what I prescribe is transdermal routes. You can take estrogen orally, but there's additional risk factors associated with it. And when you're taking it transdermally, it does increase that safety profile.
So that would be like a patch, right?
Yeah, patches, there's a spray, a gel, there's also a vaginal ring you can use.
Okay, and I would say that a lot of times you might be going, and I don't know what your take is on this, but my understanding from interviewing other experts, you might go and the traditional, if you ask for it, it might not even be brought up in your OB appointment, but if you ask for it, they might say, okay, here's a combi patch. I've been told it's better to separate them so that you can control them.
Right. And I agree with that completely. It's definitely easier to make adjustments when they're separated. And also, progesterone has a lot of benefits to it if you're taking it orally. It can really help with sleep and reducing anxiety. But when you're taking it transdermally, you're kind of bypassing those benefits.
Oh, okay. So, and the old way used to be telling women, well, whatever happens, you could just stay on birth control if you want until you're 55. And yet most menopause experts, I think, now say, no, that's not what you should be doing. Can you dive into why some people might be being told that and why it might be different to do HRT?
Yeah, honestly, safety profile. Hormones that are in birth control pills are a significantly higher dose. They're pretty much sorry, not bioidentical, but the synthetic hormone. So they're going to come with additional risk factors. Also, you're taking them orally. So it's going to your liver, which increase clotting factors and things like that. So as you're not needing the birth control piece of this anymore, we can go with a more gentle approach, lower doses, and better bioidentical hormones to increase that safety factor as you're aging.
Yeah, and when we hear bioidentical, some people might be thinking, wow, those are the creams that are like from some fancy place that are super expensive and I can't get covered. But that's not necessarily true, right? You can take an estradiol patch that's bioidentical and your insurance would cover it?
That is correct. Most of the hormones that I prescribe are bioidentical, the estradiol and the oral prometrium, and those are covered by most insurances and able to pick up at your local pharmacy.
How do you know what the dose should be?
When we're starting off, we typically start very low just so that we're minimizing side effects and then constantly adjusting how you're feeling. Are your symptoms being controlled? Are you having any side effects? And then, change the dose accordingly.
So a lot of women also, when they're going through a lot of mood issues, it's not uncommon they're going to their primary care and walking away with an SSRI, an antidepressant. Here's some Lexapro. It's very common for women your age to have this, and you've got a lot on your plate. Just take the SSRI. What's your take on that?
I mean, it's definitely possible that you could get some symptom relief, and it's a very valid option for women that cannot take hormones for whatever reason. But the gold standard to, improve perimenopausal symptoms, menopausal symptoms, and the health protections that come with hormones would be hormone therapy.
Okay, and so if you're doing the hormone therapy, you might be able to come off the antidepressant if that's something you were already doing?
It's possible, and it depends what you're taking it for. Some of those SSRIs are prescribed for hot flash management, also mood changes. So if you're on the hormones, you probably won't need the SSRI for hot flashes any longer. Mood changes can also improve with hormone therapy. It's not uncommon for women to notice changes through this transition that can be managed with hormone therapy alone.
Okay. I want to show people how they can actually come to our event. So if you're watching this long and you're interested, grab a girlfriend, grab your mom, grab anyone. Mastering Menopause is Thursday, October 16th, 5:30 to 8:30 p.m. It's going to be at the Mandel JCC in West Hartford, which is 335 Bloomfield Avenue. Tanya's one of the speakers. We also have some experts in physical fitness, how your workouts need to change, why we need to start lifting more weights, eating more protein. You're probably hearing this if you've even looked into this a little bit, but I want to go back to Tanya now. So Tanya, this is really amazing that women are going to get to be able to ask experts. And I love that you're local because you actually have a practice. People can see you. I mean, women, as you just mentioned, should be seeing someone who's an expert in menopause. So this is a way to get access. When people ask me, like, who do I go to? How do I find someone? I know people can see you, so shout out how we do that. But also, how do we find a good provider who's educated as you are as a specialist in menopause?
It is still definitely challenging. I'm accepting patients here in Hartford. I do also have my own private practice. But if you're looking for a provider, a great resource is going directly to the Menopause Society. And you want to find somebody who is certified with the Menopause Society, more likely to have more updated knowledge in that. So you can look there. They break it down by state. So you could typically find a provider in that space.
Okay. And that would mean you've had extra training specifically in menopause, perimenopause, HRT, all the things that women are curious about now.
That's correct. Yeah.
Okay. So if we're going to do hormone replacement therapy, for most women, that would mean doing a patch for estradiol and an oral progesterone. And would that be it? Would it also be testosterone? What's your take on all that?
That's the most common estrogen and progesterone situation, but there's definitely a lot of alternatives that are available, so we could tailor that to the patient's needs. But yes, testosterone is also a hormone that I replace quite frequently through perimenopause and menopause.
And that is a little bit different, right, with how the FDA is treating it? Can you still get testosterone covered? I've heard women saying it's really feeling life-changing as far as their energy.
Yeah, it is a little bit more complicated. We don't have a female product here in the US. It's not FDA approved for women. However, it's widely supported by the Menopause Society, and there are other countries that have a female product. But currently what we're doing is prescribing a male product that you can pick up at your local pharmacy. We just tailor the dose to make it for female. So we're basically using 1/10 of the product.
And you just touched on something. I mean, they're just... I'm glad we're waking up to this now, but women have been really underserved in this area. You just said that there's a product for men, but not women. And that seems strange, right? I mean, there's just hasn't been the tests or the money or the education for women's health.
Yeah. Absolutely. I definitely feel like there's a huge gap in menopause care. And this is really what piqued my interest. You know, I was also that provider that told women if you were having regular periods that your hormones were fine, until it started happening to me and realizing that wasn't an acceptable answer. So kind of what caused my deep dive.
I mean, I think, you know, I love my doctors, some of them have been great, but like, even in the last couple of years, there's been an explosion of information. And let's talk about that. It used to be, my mother, I think, was put on hormones and then immediately taken off. We had this study, everyone thought it was going to cause cancer. We now have basically, science is debunking that and saying that a lot of that was wrong information. And the new guidance, as you said, is most women will benefit from HRT.
That is correct, yes. So we've gone back and looked at the study that over 20 years caused the problem in the first place. And even their own data doesn't suggest that hormones cause cancer. You know, the risks were widely overstated. But once that study was out and that information was disseminated, the damage was really done. And it's taken us 20 years to really look at the safety profiles and come back and say, you know what, we had this wrong. And so now we're restarting that education, trying to, you know, get back into residencies and that and get our new doctors coming in educated.
Are the new med schools actually paying more attention to teaching menopause treatments?
I'm not sure if protocols have changed just yet, but I definitely know there's a lot more people paying attention and asking questions. There's a whole revolution going on here. So if not yet, then soon, I'm sure.
Yeah, absolutely. Okay, I want to take one moment and hear from one of our sponsors in the mental health space, and then we're going to come back and talk more about mastering your menopause. Here's a message.
Struggling with gambling? Wheeler Health's Better Choice program offers personalized support and treatment to help you regain control. Visit WheelerHealth.org to learn more and take the first step towards recovery today.
All right, we're back and we're talking about mastering perimenopause and menopause, and I'm here with Tanya Smith, who's so thank you for being with us as we explore this. Let's talk about some of the lifestyle factors. What do you recommend? Because my understanding is we need to change a lot once you hit those times where your estrogen is taking a deep dive and falling off a cliff.
Absolutely. One of the number one things that women are complaining to me about is this weight gain that comes out of nowhere. So women who have never had issues maintaining their weight now all of a sudden are noticing increases in body fat and just overall pounds are increasing. A lot of this comes from the inflammation that occurs once the estrogen becomes deficient in your body. And it does change your metabolism, the way your body is processing glucose, and can result in weight gain. So yeah, the same rules that you had years ago where it just said, you know, move more and eat less and you'll lose weight do not apply anymore. So we're really trying to teach women that trying to increase that lean protein in your diet is essential, making sure you're getting enough fiber, lifting weight so you're putting pressure on your bones and muscles to improve the density and muscle mass, and also just keeping like low inflammation cardio. So like walking, things that are gonna, you know, keep your stress levels low.
Okay. So how often, how many times a week? Because the other thing that women are really exploring is GLP-1s and trying to master. I've had a lot of people say, I just finally gave in and I'm doing it. And they think they're having so much success, but they just thought menopause was preventing them, midlife was preventing them, life was preventing them. They don't have a lot of time anymore. They're running around with jobs and kids. Can it work what do you have to do to dial in and lose that weight?
It is a lot of work, and I'm not going to sugarcoat it and say that we'll just put you on hormone therapy and all of your weight will just magically balance out and everything will be fine. It really is a lifestyle change. You really need to work on that nutrition and get your glucose in check. And so those GLP-1s do work synergistically with hormone therapy to help really target some of the issues that you're struggling with that can help get you better results. So it is an option. I really encourage my patients to master the lifestyle changes first because you don't want to end up less healthy, just weight loss, but less muscle and less bone density, leaving you less healthy than when you started. So
right, and the empowering thing is, we don't want to end up like our mothers and grandmothers on walkers and not active. And with the right knowledge and protein and working out, you can have a lot more longevity and lead a much better life many, many more years, because if we need to maintain our strength, but we can if we know what to do.
Yes, this is correct. See, we've outlived our ovaries. Most of us are losing that ovarian function by the age of 50 or so, and would ideally like to live another, 30, 40 years of good health. And so if you're taking the steps right now to help preserve your bone density, preserve your muscle mass, maintain your cardiovascular health through exercise, diet, and balanced hormones, you're more likely to have a higher quality of life as you age.
So let's just say, what's the sweet spot? Women, they say there's that. I was reading that when it comes to taking HRT, like how long do you stay on it, and where does it make the most impact?
So there's a window of opportunity basically within 10 years of that last menstrual period to get started on hormone therapy. After the 10 years, the risks for starting at that point, become higher because there's concerns for already damage to the cardiovascular system that could increase your risk. That's not an absolute, so I do still think it's worth the conversation, with a provider that's knowledgeable in this area to talk about your risks and benefits. But ideally, you're trying to get started with hormones within those first 10 years.
What if you're someone who loses your period very late? I mean, some women keep getting their periods way into their 50s, even 60.
Most common age is to be done by 55. So if you're still getting it beyond that, you should definitely check in with the provider and just make sure everything is okay there. But honestly, it's been a benefit. You've had longer period of time with circulating hormones. One would think that would, help preserve your cardiovascular health and bone density just a little bit longer.
Okay, yeah, asking because I know some friends who are like, it's still, maybe irregular, but so that doesn't mean you shouldn't be taking HRT, even if you are occasionally.
Yeah, I mean, symptoms can start long before that, and there's absolutely no reason to suffer. You'll definitely see health benefits and protections from getting started early on. So
once you start taking the HRT, how do you know that you're on the right dose and that it's working?
So you should see at least an 80 to 90% resolution of your symptoms that you came in with concerns for, so like hot flashes, joint pain, night sweats, things like that. And then we're just watching for side effects. If your estrogen level's a little too high, sometimes you'll get some breast tenderness. That could be an indication we need to take it back a little bit, but really just seeing how you're feeling and making sure symptoms are well controlled.
Okay. We're going to be there. People are going to be able to ask these questions, but what are some of the main questions that people are asking you right now that we can share with the audience that I'm sure that everyone else is asking too?
Well, again, the biggest one is always the weight loss.
The weight, right. So does that mean no carbs, or do we need carbs, or, do you have to reduce your calories a lot?
I actually encourage my women not to focus so much on calories and even carbs. I encourage people to add back into their diet. For the most part, women have been told forever just to eat less, and now we're really good at that at this point. So trying to incorporate that lean protein, making sure you're getting, 20 to 30 grams of lean protein 3 to 4 times a day, stuff like that.
Yeah. So, no, I mean, seriously, like a perfect breakfast in your world, what would you tell people?
Lead with protein with every meal.
Yeah.
So whether it's a protein shake, you're having some eggs, I mean, there's no rules. You can have chicken for breakfast if it works for you. But anytime if you're leading with the protein before you have the carbohydrate, it's going to help slow some of that glucose spike and help keep your glucose in check.
And that's really important because people who aren't diabetic, maybe not even pre-diabetic, might have some insulin resistance. And that might be why you're getting fluffy and gaining that extra weight and the muffin top that we call it and all that. So just even switching, I can't believe how much the exact same food, chicken first and then the grapes, it's a completely different response. Like we want to have the protein first on your plate.
Yes, it's absolutely true. It's going to make a huge impact to your overall glucose levels. And you know what you did with the glucose monitor is a really great idea, because even if you're not diabetic, there are some blind spots that you might not be aware of that, you know, if your sugars are high through the night, that's going to also impact the quality of your sleep and, you know, affect how you're feeling the next day.
A lot of people are trying to fast, but I have found it incredibly difficult to do intermittent fasting. I mean, for any length of time, maybe when you're sleeping. But I've heard that for women, it can be much different and more difficult, and maybe not even the way we should be doing it compared to men.
Yeah, we have to be very careful through perimenopause that we're not creating an additional inflammation in our body, because that's already a big issue. So when you go long periods of time fasting, if that's creating stress for you, that could be creating an increased inflammation and having a backfire effect on you. The other concern I have with long periods of time of fasting is it's really difficult to get adequate protein in a shortened time eating window. So, you know, if you're going to do that, you still got to make sure you're hitting your protein targets.
Yeah, so you're looking for about a gram of ideal body weight. So if you want to weigh 130 pounds or something, you're trying to get 130 grams of protein a day, which you probably wouldn't get unless you're being pretty intentional about it.
Exactly. You really want to break that up over like 3 to 4 meals of 20 to 30 grams each bolus. So you're spreading it out through the day.
All right. We've only got 1 minute left. I just want to bring up the location of the event again so that you can come see Tanya and all of the other great speakers on Thursday, October 16th, 5:30 to 8 p.m. at the Mandel JCC in West Hartford. It's Mastering Menopause. It's free. We're going to have a link on WFSB.com. And I have it on my Facebook page as well. So just register, but it is absolutely free. And I know they're going to close the registration in the next day or so. So I hope as many people can come and learn and be educated about this as possible. Tanya, thank you so much for your time.
Oh, thank you so much for having me. It's been great.
Yeah, absolutely. I know we're going to get even more information at the event, but it's an important conversation that women need to be having. So we appreciate you being on CURES.
Excellent. Thank you so much for having me.
Thank you, Tanya. And everyone at home, have a great day, everyone, and be well. And I hope you're subscribing to the CURES podcast on any platform. And you can always watch it for free on WFSB Plus and the Wax.
CURES is sponsored by Wheeler Health's Better Choice program. More at wheelerhealth.org.